Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. Today's presentation to our viewers is about the early diagnosis of autism among children during 12 months to 5 years of age. Previously, I have done podcast on this, plus I have written articles for publication for the journals. But this one is just, I am concentrating more about the brain function and what leads to these kids in early age for the autism spectrum disorder. Okay, so for the viewers to know, I have simplified. I have shown some structure of the brain. You know what is the mechanism of the chromosomes disorders, which is what the autism spectrum disorder is, and how these chromosomes they follow a path in the neural pathway. They go to the front part of is the cerebral cortex, and approximately 30 billion neurons, they all spike to the cortex area. Mostly the chromosomes, due to the early mutation, some of the bad chromosomes, they accompany the neurons in the front pathway, and that is how the symptoms start. Amygdala, that is a little area in the base of the brain, and that controls the emotions of the individual. And this area of amygdala is underdeveloped in the children. As the kids mature, it becomes more and more development, and the amygdala it is the detector of all the hyperactive behaviors and everything, and which way to go. Now there comes the arrow shows the area of hippocampus, and the hippocampus it is larger in many people with autism. This change may be associated with the symptoms linked to the autism spectrum device. The glia is the area of the brain that controls the action and the neural pathway. So what are they now? The next. So these children. What happens to these children? It is first of all, what is autism spectrum disorder? It is a developmental disability that is caused by differences in the brain functions due to the chromosomes mutation. These children often have problems with the social communication, the interaction, as well as a restricted behavior issue. The children can also have difficulty focusing, delayed learning, or paying attention, and to the parents, caretakers at home and at school. So what are the causes? Scientists have done a lot of researches on this particular area or this particular spectrum disorders. Scientists have proved the fact that the genes are the contributory factor, and this is one of the genetic disorder. More than 100 genes on different chromosomes with their abnormality are causing this. And researchers have classified into mild, moderate, and severe. The current, what are the risk factors? Very important for us to know what are the risk factors. The current available researchers prove the fact that certain chromosomes or the genetic condition, they predispose to developing the disease at an early age. There is evidence to suggest that genetics play a significant role. Male children are more affected, presumably from the genes passed from the father. However, mothers are also the carrier. Single gene disorders such as Angelman syndrome, chromosomes 15, trisomy, these are all commonly associated with the ASD. And at the end of every reading, I have included the bibliography so anybody can go through the bibliography. The inheritance pattern is unknown. However, incidental finding of a autistic child may happen also in the normal parent as well. So what are the main causes? I have summarized the main causes after doing a research studies of many available journals. There are many different factors such as environment, biologic, genetic. Other risk factors include a sibling with autism, older parents, genetic conditions such as Down syndrome, Tourette syndrome, Autism National Institute of Environment Health Science. This is where I gathered the information. Furthermore, complicated pregnancy, premature birth, low birth weight, maternal history of diabetes, high blood pressure during pregnancy, high level of depression, stress can also lead to autism in a born child. The behavior symptoms of this ASD may show is as early as 12 to 18 months of age. So what are the signs? I have summarized the signs of it. Early age, limited eye control, repetitive movement of the whole body, no response to hearing their name, limited response to loud sound, delayed babbling. All these babies are. It is interesting to know that these babies are well developed, have a normal physical appearance, and they are cute. The older kids, on the other hand, they will have a delayed cognitive or learning skill, hyperactive, impulsive, or inattentive. A baby who does not like to be held, cuddled, constantly crying may be a real, very early sign of it. The ASD are classified minor, moderate, or severe. And this depends upon the genetic chromosomes involvement. There have been several retrospective studies done on a large population, Italian parents with the epilepsy and the ASD interrelated, all due to genetic, metabolic, and the brain lesion. There have been no definite decision made except for the fact that some children with epileptic disorder may develop autism spectrum disorder as they grow old. So what are the diagnostic tools for autism? Very interesting to know. Following are the diagnostic tools. Autism Diagnostic Interview Revised. This is a clinical diagnostic instrument for assessing autism in children and adults. Autism Diagnostic Observation Schedule, Childhood Rating Scale, and Gilliam Autism Rating Scale. And this is all I have given the bibliography. I have mentioned where I got all this information from. So diagnostic tools. Two of the leading diagnostic tools to screen and diagnose from the pediatrician point of view DSM-5 and MCHAT. This is a modified checklist for autism in children. Role of pediatrician in diagnosing is very, very important. Any child suggestive symptoms of delayed speech, hearing, or eating disorder should be checked regularly at the pediatrician, and they can follow the DSM-5 criteria, and the one with the low score should be sent to the behavioral health services. They should be sent to the other areas of the behavioral, like social. Start with the social service consultation, and furthermore, the further legislation and committee on the children, according to the Academy of Pediatrics with Disability, have described some current tools according to the age as a method of diagnosis. Role of social worker and behavioral therapist are very, very important. The social workers, along with the pediatrician, they engage themselves in research, practice, education, and support for the families and the community. The National Institute of Health, the Behavioral Management Therapy, they try to enforce the behavior according to the age, and they reduce the unwanted behaviors, that is follow the guidelines of Academy of Pediatrics and Psychology. The role of psychologist is very important, since they can assess areas of the concern, the strength, and the recommendation. Several studies have established that intensive long-term therapy does improve the outcome of many autistic children. So what are we do? Applied behavior analysis and conclusion. Children's behavior are consistent with law of learning derived from the behavior and reported from other sources. Autistic children have many separate behavior issues that is best described as in the developmental delay. The social workers also, they are an organized group, therapists with the parents, caretaker, and the school teacher. In summary, the types of treatment include behavioral development, education, social relations, pharmacologic, psychologic, and contemporary alternative. In summary, the aim of current treatment are to reduce the symptoms that interfere with the daily function and quality of life. The treatment plan also involves many professional furthermore treatment aimed to a better education. So in summary, I have talked to you about this autism spectrum disorder. The food nutrition play a very significant role, and my previous podcast on this have emphasized on the proper food and the nutrition. The American Academy of Pediatrics have come out with a tool that is used to diagnose this condition babies as old as 6 months of age. Now, I haven't had time to do the research on that, but later on I will add it to my note about what are the tools that are used for early diagnosis of the autistic children as early as 6 months of age, which will be very helpful. So I'd like to thank our viewers on this manuscript, on the slide presentation of the autistic spectrum disorder, and when I add to the more researches, I will have another one. I'd like to thank all of you for watching me. And my previous podcast was with a guest speaker from Ann Arbor who talked about this in detail as a school teacher point of view. And I would send the link to both of them. And I'd like to thank you sincerely, my producer, my camera people, for helping me preparing my slides. Thank you again.